Hey guys, it's Miss Woodruff and Miss B again. So we're here today to talk about PO Med administration. So this may be pretty simple. You're like, hey, you just put the pill in the cup and everything's good, but there's a lot more to it. You always have to think about, both sides to this administration. The first side is the medication. So we're about to give this very high risk drug, also known as ibuprofen.
Hi, Bill.
So yes, let's talk about what we would do to prepare. Miss B, can you tell me a little bit about what I would need to know about the med?
Okay, so it's very important that every time you give a PO medicine or any medication, that you really first assess, is it appropriate for the patient? Even though that maybe a physician might give you an order, it not necessarily is appropriate for the patient. And that's what we're there. We're the brains, basically. We're that barrier between the patient and the physician to make sure everything works great. So you're going to look up the medication. You're going to identify any side effects, any medications that could interact that you already have given to the patient, you're about to give. Can they work together? Can they be given together? You're also going to really assess, or at least know, how does this help my patient? What am I looking for if I give this wonderful drug, Advil, to my patient? What am I looking for once I give it to the patient? Am I looking for perhaps the fever is going to go down, or their pain is going to get better? Because we're talking about Advil, but maybe we're talking about a cardiac medication, maybe we're talking about an antibiotic. Also, another thing that we're looking for is, and I went blank.
Yeah. Well, no, I was going to go back and add to your interactions thing. You're thinking about interactions like, hey, if I give this, like, for example, some medications need to be given on an empty stomach, or like what we talked about with antacids, some of them cannot be given at the same time. But you also have to consider about the synergistic effects of two medications. So let's say that I gave a blood pressure medicine and also a pain medicine at the same time. Those are going to have synergistic effects, and both of them can decrease my blood pressure, which can cause me to have some serious, complications. So I always want to think about, like, if I'm given, in the morning, 9 o'clock, sometimes they have like 15 pills, and I have to think about, okay, I'm given all these at the same time. Is it safe? How have they reacted to them? And you may be surprised. Some patients, they might take like 6 blood pressure medications,
Mhm.
and you're thinking, whoa, that's way too many. And that's fine for them. But it's all about knowing, if, especially if it's new or different for them, or there's any medications they haven't taken together, you always want to be looking careful for those interactions.
And collect any data that you need before. For example, a
Hmm.
blood pressure medication, you're going to need a current blood pressure or a current heart rate. So not like a 2 hour that your
Yeah.
PCT collected ago. So make sure you're collecting that data as well.
Mhm.
Did I forget anything?
I don't think so. I think you got it.
Yeah.
So yeah, so now once we've figured out about the medication, we've collected any necessary data, whether that's getting vital signs or looking in the chart for any necessary labs, diagnostics that we may need for that procedure, for to give that medication. Then we want to think about the patient. So, the medication can be safe, but then if the patient has any barriers, like for example, maybe the patient seems like they can talk, everything's going well, but maybe they have problems swallowing, and they may be there for a problem swallowing, or maybe they had surgery and their throat's a little swollen from having a breathing tube. It's hard to say, but we always want to ask them, hey, how do you swallow? In order to administer med, they also have to have some sort of liquid at the bedside, and you want to know what their availabilities to swallow are. And what I mean by that is that, some patients, they can swallow okay, but they need their stuff crushed, and they need it in like pudding or something that's a little bit thicker to help them to swallow it. So always asking kind of where they're at. And if they don't know, you want to always check by their bedside. There may be special swallowing precautions, and those are usually listed on a sign behind the bed, or there may be in their MAR, it may say, hey, crush all meds or do this. So you may want to listen for that in report. I usually like to ask in my report, how does the patient swallow? Do they do okay? Are they taking their pills okay? Especially if they're high risk. And so some diseases you may want to worry about is if anyone's had any head, neck, or face surgeries. If anyone's had a stroke, they're going to be higher risk for problems swallowing. What do you call it? If anyone's had a sore throat or respiratory condition, they may also have problems swallowing. Anything else you can think of?
Even dementia, that is
Dementia. Oh
very
yeah,
common in the
confusion.
med search floors.
Hmm.
The patient, when they have dementia and Alzheimer, usually they forget to swallow and they have difficulty swallowing, which leads to aspiration.
Hmm.
Yeah.
Yeah, that's a good point. Um, And so then what you also want to do is think about like, okay, even if let's say they swallow well, like how much can they handle at one time? So let's say I have 10 pills to give 'em. I'm only giving one pill right now, but let's say I had 10. I always want to ensure that, I'm asking the patient, like some patients, they just want to down them all at one time. Some of them, they say, oh, so many at a time. Some people have like a regimen. I'll take one little, one small, one big,
Yeah.
one in the middle, whatever. But, just always listen to that patient. We call them in what you're doing. So at that point, do you have anything to add about the patient?
Mm,
Then you're going to gather your supplies. So what you're going to need is you're going to need your pills, and we'll talk more about these. You're going to also need a pill cup. I'm going to talk about a basic administration, and I'm also going to add in what if there's like I have to crush the meds or something else. So what do you call them? What my steps are? I've checked the med. I've checked with the patient. I make sure that they have something that they can drink. Here is your drink, ma'am. So yes, ready to drink. So then what I'm going to do is I'm going to go in, I'm going to wash my hands, put my gloves on, and I'm going to tell you about this that I know that a lot of students are like, well, I'm not touching anything. Why do I really need gloves? And it's the same thing. Well, maybe a person's not really touching the food that they're making for you, but do you really want them not wearing gloves? So sometimes it's partially for appearance, but you just never know. I have been in so many situations where I really wish I would have put gloves on. I didn't think I was going to need them, but you just never know. And especially if you're like have a lot of supplies and stuff like that, you just want to make sure that you are doing things cleanly and effectively, but also preparing for the fact that, if you're coming into contact with a patient, you never know when, a bodily fluid or something may happen. So I've identified the patient, asked about allergies, put my gloves on. I'm ready to give this med. I look and check my order and double check. And when I check my order, I always like to take the pill and actually hold it up and look and make sure that it's the right medication, right patient, and do all those 5 rights. Um, and I'm going to give you a couple tips for opening pills. So there's what do you call? There's 2 types of pills you may come into contact with. One is where you peel back and then you can drop it in. Always drop when you're dropping it in. Face it the what you're going to be doing down. There's another type that you can peel back or sometimes just push through. Never push up or out. Always push down into your pill cup. And keep in mind, some of these can be projectiles, so they can bounce and then go everywhere. And if it's a narcotic, it's a pain in the butt to, sometimes they always like hide in the weirdest places. So be extra careful when you're putting that in. Take your time. Don't try to force it out. And just know that you thought nursing school was hard, but the hardest thing you may do is try to open medication sometimes. Do you have anything to add to that part?
And if it falls, it's okay. It happens to anyone. We just have to tell the nurse, and the nurse needs to grab another one. If it's a narcotic, it needs to be wasted. But never, 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 for more that the patient tells you, oh, 3 second, 5 second rule, pick it up, never pick it up and give it back to the patient.
hmm So yes. So what do you call it? Once you have everything and you've put it into your pill cup, I highly recommend you use these. So what a lot of I see a lot of students do is they'll take the pill and put the pill right in the patient's hands, or they'll take the pill cup and pour it in the patient's hand. And this is what it ends up. And they're trying to do this. And I'll tell you, it ends up with pills being lost. And then later you're doing a bath and you find a bunch of pills in their bed and you don't know even which ones they didn't get. So it's just a mess. You can look those up. Every hospital should have a like on their like LexiComp or whatever they use, there's something where you can actually search and describe the pill and it will tell you what it is. But you don't want to have to do all that, especially if there's 5 pills in the bed. So I always recommend putting it directly in their mouth or having them use the pill, pill cup itself. So I would get my pill, I will gently put it into my cup, and then I'm going to go over to my patient. I'm going to say, okay, this is your Advil. It's for your headache. You should start to feel better shortly, but it can increase your risk for bleeding. So let me know if you're see any signs of bleeding anywhere.
Thank you.
And so then I would give her her pill. And then I'm going to watch and make sure she swallows it. We do not leave pills at the bedside. If they say, hey, I want to take it later, I tell them, hey, I need to see you take it before I leave. If they're not ready to take it, then I will hold on to the pills, but you cannot leave it, especially if there's narcotics or anything in there, especially if there's someone at the bedside. But, I see some people that are like, oh, I'll eat it after breakfast. But you definitely, that's why it's really good when you're first talking about the patient. You want to make sure that they're ready to take it. We don't have a scanning system here to kind of show you, but I think a great like organization to your med administration is after you've scanned the patient and everything, scan a med, say, hey, I'm going to give you this medication. It's for your whatever, maybe if you know some teaching or there is an important teaching, include that there. But the reason I do that, before I even put that pill into the pill cup, is sometimes patients don't want all their medications. And it's a horrible thing to like have gone through 20 pills and be like, here's your medication. They're like, I don't want one. And I know you're probably going to say that never happens, but I actually actually had it happen to a student where they put a bunch of them and they're like, I don't want some random med. And so we had to go find out which one it was and out of a bunch of pills. And so you always want to make sure to ask, like, tell them what they're getting, because they may say, hey, I don't really feel like I need that. But you always want to make sure that they're educated about it as well. So pretty much scan the patient, then say, hey, I have your blah, blah, blah. It's for this. And if they say, okay, scan it, put it into your pill cup, then the next one, and then you can kind of go on and so forth, include any teaching. And then do you want to talk a little bit about the follow up after giving a PO meds?
I do want to add
Oh,
something
sorry, go ahead.
to what you said. Another problem that happens sometimes with patients is that not only is it that they don't want it, but sometimes they're very particular and they don't look, the pill itself don't look like the ones that they take at
Good
home.
point.
So they actually ask you, oh, well, I have 5 pills in here. Well, which one is which? And if you haven't separated them or you haven't, like, basically taken your time slowly to look at them, you might not be able to answer that question for them. So that's another reason why
That
to
is good.
slow it down, separate them, scan them,
hmm
tell them what it is, show it to them,
hmm
and then open it
Yeah.
at the end.
And I will say real quick before you go to the follow-up is that you may see in some instructional videos that it says to give one pill at a time, and that's not necessary. But if they have a lot of pills, you may, try to give them a little bit at a time. So you're not like, here's your 25 pills,
Mhm.
kind of give them that time. But it can be up to that patient. And sometimes it depends on their level of knowledge about their medications.
Yeah, that's correct.
Mhm.
So on the follow up, depending on what the medication is, especially for example, pain medication or medication for reflux or medication for nausea or even a bowel movement, you always want to come back to the patient's room and ask them, was it effective? So let's say it's a pain medication. You want to reassess that within the hour and just ask them, is the pain level better? And what can you rate it for me from 0 to 10? That way, you know if your medication has done what it was intended to do, the effectiveness of it. And if not, let's say a nausea medication, you started with Zofran and you went back an hour, it hasn't touched the patient. Okay, well, you look at your MAR and you find what would be my next medication to give to the patient, or what are my possible options. Maybe I don't have an option, then maybe I need to contact the physician for another med. So evaluation of the patient after medication administration is crucial, and it needs to be done by every nurse.
Mhm. Yeah, and the only thing that I would add there is, generally with most PO meds, if it's a relief medication, it should work within 30 minutes to an hour. Some may be longer. You always have to keep in mind if you see on a medication ER, it means extended release, or it could also be DL, which is delayed. Like, when I say DR, maybe delayed release. Yes,
Mhm.
what you call it?
Or CR.
CR. That's it. Yeah, yeah,
Mhm.
controlled release. And so some of them, they might have that on there, and that means it's going to work over time. That also means that you should not crush it. So, kind of getting to that, let's say that, Mrs. B here could not swallow well. What I can do is I can take my pill and I can use one of these handy dandy. They have these little baggies. And what you can do is, and I guess I don't need the baggie for this type, depends on the type of pill crusher you
Yeah.
have. Some of them you're going to put them into a bag and then you're going to crush this in the bag. But for this one here, and I guess I can push this down here and show you what we can do with this is we can put them here. And there are some hospitals have more up-to-date ones that are going to be, what do you call it? I won't actually crush it. So, yes,
Oh, you
but
can crush it.
oh, we
It's
cut,
okay.
yeah, so, but we cut, some will have like a more of a handheld one, but pretty much I'm going to be sitting here and I'm going to be hitting this and making it small and breaking it down until it gets small enough. And I don't want to get too crazy here, but I'm going to act like this got a lot more crushed than what it did. So, or maybe it actually did pretty good. Okay. So yeah, so you want it very fine. This was not very incredibly crushed.
You can put it in here so they can see.
Yeah, oh, that's a good idea. So this, I did not crush this intensely well. Usually I would have crushed it until it's a fine powder, but to kind of give you an idea, you crush it, you put into this, you can mix it with water, you can mix it with juice, you can put it in pudding, just depending on the patient. So once it's crushed up, then again, I just figure out what I find what's most appropriate. Just make sure you're not crushing anything that's not meant to be crushed. And a lot of times it will tell you in your MAR if it's okay to be crushed or not. You can also check with your pharmacist. If they need to be crushed, usually it's given via what do you call it, pudding or other snack, like maybe some Jello or something like that, or it can be mixed with juice. Just always know the patient's diet and precautions when it comes to doing that. Anything you want to add about crushed meds?
I think you covered it. Just be careful with PEG tubes.
Mhm,
People that have NG tubes or
mhm,
PEG tubes in their stomach, sometimes it has to be very, very, very
mhm.
fine.
Yeah, it has to be
If
much better than this.
not, the tube will get caught.
Yeah, and so to kind of get into that, so let's say that this I was giving this via tube and I wasn't giving it like the patient was not going to take it by mouth. I can pour it into a little cup like this and put a little water in it. And then I'm going to use something like, I'll pull this out real quick. I'm going to use something like a syringe, and some of these are like this one's a 60 cc syringe. And then what I'm doing is pretty much I mix it, and then I draw it up in the syringe, and then I insert this into the patient's tube and give that medication. Just like an IV, you want to flush before and flush after the medication to make sure the tube is patent, and you're still going to look for those same effects. It may be a little bit sooner because the medication is crushed, but you don't really know. It just depends on the tube and what's in their belly and things like that. Then always make sure to keep everything clean. Even though you're going into the belly, you want to keep things as clean as possible in order to prevent infection. Anything to add?
I think we got it.
Yeah. All right. Well, we'll see you for the next video. Bye.